Um, so we have been focusing our attention on the arteriovenous system. One last piece here to finish talking about circulation. We know that blood returns to the right atrium primarily via the superior and inferior vena cavas. So this blood return here is intended to illustrate the major venous return to the heart. So there's two major vessels, one from the top, one from the bottom, that constitute most of the venous return to the heart. The venous blood then, returning to the right atrium, travels into the right ventricle, and then through the pulmonary artery, as it were, the pulmonary trunk, and passes into the capillary network of the lungs, that we call the pulmonary capillary network, where the blood is oxygenated. And the oxygenated blood returns to the heart to the left side via the pulmonary vein. So the major supply to the left ventricle, major blood flowing into the left ventricle for circulation, is via this pulmonary venous system coming from both sides of the lungs. There's multiple vessels here connected to the left atrium. And then the blood flows into the left ventricle, and then it passes from the left ventricle out into the aortic arch, and from this aortic arch we give rise to the brachiocephalate, left common carotid, left subclavian, thoracic branches, abdominal branches, etc., into their capillary networks, and then around the circuit we go again. Now, in these capillary networks, this illustrating the pulmonary capillary network and this one illustrating the rest of the body, the systemic capillary networks, we will find that the fluid that exits by way of these capillaries into the spaces, into the tissue spaces, does not all flow back into the system via the venous networks. So these venous networks that carry blood back into the major flow in the system are not capable of collecting all of the fluid that is lost out of these capillary networks. In order to do that, the body has another system of circulation called lymphatic circulation, where capillaries that are actually dead-ended capillaries, notice there is no network here, are to be found in the areas where the normal capillary beds are located. Now, these capillaries, we call them lymphatic capillaries, are structurally different than the normal capillaries, in that the simple squamous cells of these capillaries are overlapping but non-connected. That is, there is a free flow of fluid into these capillary networks without resistance, because the cells of the capillary bed itself do not union, they do not join. They simply overlie one another. So any increase in pressure at all will allow excess fluid to flow into these capillaries. Now, these lymphatic capillaries are connected to vessels, lymphatic vessels. And the walls of these vessels, the anatomy of the walls of these lymphatic vessels, very closely mirror the anatomy of the walls of the veins. That is, you would find an endothelium, you would find a thin layer of smooth muscle, connective tissue, outer line of the lymphatic vessel. And you will also find, like their venous counterparts, you will find valve systems. So these little bulges in the image here are intended to point out to you that they also have valve systems within them in order to prevent the backflow of the fluid. And some of you are already guessing. You told us that the venous system has valves in it, but it's also located typically in skeletal muscles, so that those skeletal muscles serve as a pumping action when they contract to move fluid through the venous system. And you will find the exact same thing in the lymphatic vessels. They tend to be located very close to their venous counterparts, and they have, so located in the skeletal muscles, and they have valves, and so they have the anatomy pieces of the lymphatic vessels mirror the venous pieces for the same reasons, because there is no pressure in this system. So in order to move the lymph through the system back into circulation, in order to move this excess fluid that has been taken up by these capillaries, you need these special pieces of anatomy, these veins and their locations within skeletal muscles. Now, the other unique thing about this lymphatic circulatory system is all along the way, as the lymph is taken up in these capillaries and moved back toward the heart, all along the way you will find nodules, clusters of nodules, that the lymph flows through on its way back to circulation. So this is the same logic that we used at the end of our circulation when we were talking about digestion. When I told you that the nasty stuff in the hepatic portal vein and hepatic artery are going to mix within the liver tissue. So you will need pieces of the immune system present here in order to deal with the material that's coming into the liver via the digestive system. In this case, you're dealing with the material in the body tissues. Everything in the body tissues has potential to pass through this lymphatic circuit because, as I said, unlike the anatomy of the normal capillary, the lymphatic capillary is basically open space. The capillary walls themselves are overlapping cells that do not connect, which means anything in the tissue spaces can get into this lymphatic circuit. So cancer cells, for example, any kind of pathogens present in the tissue spaces can get into these lymphatic vessels. And the logic of this, the logic of the body tells you that you do not want all of the material that can be taken up by the capillary re-entering circulation. And so the lymph passes through normally series of lymphatic nodules. Now, those lymph nodes, as you can see here, are distributed. And this is a very poor illustration of the extent of the lymphatic nodules in the body, but it's just intended to give you a sense of where all this stuff is happening. And so I want to point out to you some of the major locations where you find lymphatic nodule clusters. So you can see here lymphatic nodules that you're familiar with already. Some of you have had sore throats before, and you've noticed swollen nodes in the cervical region, the cervical nodes that run in your neck. There are also lymphatic nodules in the axilla. So there's a whole system of lymphatic nodules around the areola and through the axilla. There's about a half dozen different named series of nodules that occur here. And so they pass through what are called these, generally speaking, these axillary lymph nodes. Series of them. So in the neck, in the armpit, there are also patches, normally on the medial side of the elbow, called supratrochlear nodes. So sometimes when an individual is sick, they've got a major viral infection, you can actually feel swellings on this medial aspect, very near where the ulnar nerve is passing behind the medial epicondyle, and these supratrochlear nodes here in the elbow. There are strings of lymph nodes through the thoracic and abdominal body cavity. There are lymph nodes along the inguinal regions here, very near that inguinal ligament, passing from the anterior superior iliac spine over to the pubic bone. So inguinal nodes can be palpated, supratrochlear nodes can be palpated, axillary nodes can be palpated, cervical nodes can be palpated. So there are clusters of lymphatic nodules located all over you that are responsible for helping the body deal with the material that the lymphatic capillaries pick up. Now, those lymphatic capillaries fully intend to deliver that fluid back to the system. And if you block, if some pathology blocks the flow of lymph in the system, then what will happen is the body will swell up with fluid. Lymphatic blockages create edemas, swellings, wherever they're found. So the system fully intends to put the fluid back into the system. It fully intends to take all of that capillary liquid that has been lost in the tissues and restore it. In order to do that, there are a couple of key locations where lymph drains back into the system. Two of them that I will expect you to remember. One is the right lymphatic duct, shown here joining the right side. The right lymphatic duct actually joins the right subclavian vein. And all of the lymphatic flow from the right side of the body down to the diaphragm, the right side of the body, the right upper extremity, the thorax, down to the thoracic, through the thoracic body cavity. So all of this area on the right upper extremity, right arm, right chest, right head and neck, all of the lymph from this area ends up flowing into the right lymphatic vein, into the right subclavian vein. That's how the lymph from this part of your body gets back in circulation. Now, on the left side, its counterpart is called the thoracic duct. And in terms of importance, the thoracic duct far outweighs the return of lymph compared to the right lymphatic, because the thoracic duct is going to drain everything else. So it is the biggest major return vessel of lymph in the human body. And it joins the left subclavian vein. So everything left side, and even the right side of the abdominal pelvic region and the legs, everything down this way is drained by the thoracic duct into the left subclavian vein. Okay, so that's lymph. Now, what does the lymph node look like? And let me show you a couple of other lymphatic structures. This is a mock cartoon picture of a lymph node. And the first thing that jumps out to an anatomy student when you look at lymphatic tissue is the presence of what we call germinal centers. So you can see these dark purple circular patches of tissue here. And you can see anatomically they tend to be clustered in the periphery. So around the edges, not so much through the central regions, but more around the edges of the lymph nodes, you can see these germinal centers. Now, these germinal centers are actually local accumulations of B lymphocytes, which are part of immunity. So germinal centers, the reason I say that is to point out to you, as the lymph, as you can see these green areas, is flowing through the lymphatic nodule, there are actually resident cells of the immune system present in these lymph nodes that can respond to pathogens. And so you can see the characteristic histology, the germinal center of the lymph node. That histology is present in the other lymphatic tissues in the body. So let's name some of them, shall we? Other lymphatic tissues that have this characteristic histological phenomenon that we call a germinal center. Patches of B lymphocytes, white blood cells resident within the tissue. Okay, we'll start at the top. These germinal centers are an anatomical sign that you see in tonsils. So there are 3 sets of tonsils that are present within the body cavities that have these germinal centers present in them. There's a set of tonsils under your tongue and on the back of your tongue, and we call those the lingual tonsils. Nobody thinks about those. It's a diffuse set of germinal centers. There are arguably the most famous tonsils that sit. I'm going to show you these and make you learn their specific anatomy when we return from the break. This will be part of the first section of digestive system that we look at, called the palatine tonsils. and they are located on the lateral margins of the oropharynx, in the back of your mouth. Some of you have seen these. If you've got a sore throat and you open your mouth and look at the back of your mouth on the sides, you'll see a swollen structure. That is a palatine tonsil. And there are tonsils located in your nasopharynx. So behind your nasal cavity, as you're making your way into your throat, there's a set of tonsils there. You'll recognize their name. They're sometimes called the adenoids. Those are tonsils, lymphatic tissues with germinal centers that look very similar to this histologically. Now, we will also find these lymphatic tissues in organs like the thymus and the spleen. So I have both of those here. You can see these white pulp areas are actually germinal centers within the splenic tissue. And the thymus also, a structure that degenerates with age, is also considered to be a lymphatic tissue. Now, in addition to the lymphatic tissues of my body that include the tonsils, that include the lymph nodes, that include the thymus, that include the spleen, in the digestive system, we also are well aware, and I personify the digestive system on purpose here. We are well aware, speaking as the digestive system, that there's some junk here. And so the digestive system has a number of ways to deal with this. For example, one of the hallmarks of the anatomy of the small intestine is the presence of these germinal centers inside the walls of the small intestine. So Dr. Boyce will take you guys further with this. But as you work your way through the small intestine, from the duodenum to the jejunum to the ileum, the numbers of these germinal centers that show up in the walls of the intestine gradually increases. So the further you get along in the wall of the small intestine, the more of these things you will see. And it's almost like they're building to a crescendo. More and more lymphatic structures, more and more of these Peyer's patches is what they're called. More and more of these germinal center structures show up within the walls of the intestine the closer you get to the large intestine, until they literally seem to explode into an organ that is almost completely filled with lymphatic tissue at the junction of the small and large intestine, an organ called the appendix. The appendix is attached to the first piece of the large intestine, and it is filled with these germinal centers. It is considered lymphatic tissue. Okay, so you cannot disregard the importance of the lymphatic circuit or the lymphatic tissues that are involved in immunity in the human body. Okay? Now, the last thing for the semester is the heart. Now, I've added this picture here because I mentioned this earlier in the class. I showed you a picture of the dermatomes, and I just wanted you to see this at the beginning of the heart anatomy. So there are a lot of things on this picture you should recognize, right? The aortic arch, the brachiocephalic, the subclavians, the carotids, the pulmonary trunk, the brachiocephalic veins, the pulmonary, this would be pulmonary artery, this would be pulmonary vein. So there's a lot on this picture already that you know. You also know from me that the vagus nerve, which you can see here, the vagus nerve is responsible for doing something with the heart, and it is parasympathetic. And I have pointed out during this test section that the vagus carries sensory information from the aortic arch concerning blood pressure and blood gases. That's the connection illustrated right here. You also know, you've also learned already in this test section, shown here, that in the fetal circulation there are variations in anatomy. There is a ductus venosus at the liver And there's a foraminal valley between the right and left atrium. And there is a ductus arteriosus connecting the blood flow through the pulmonary, from the pulmonary trunk into the aorta. So you have learned a lot of anatomy here associated with the heart. Now, let me tie one more piece together that I mentioned to you earlier, but if you see it here with your own eyes, it'll hopefully sink in. Notice, this heart has not been dissected yet. The pericardium is still intact. So in your CAT, when I asked you to begin the dissection, you had to cut the pericardium off of the heart so that you could see the heart and you could follow clearly the aortic arch coming off of the heart. And I wanted you to see with that section some of the blood vessels that I'm going to name for you that you can actually see here on the other side of the pericardium in this image. Now, here's why I point this out. You can see here that there are other named vessels that supply the pericardium. And I'm not going to ask you to know these, okay? So the pericardiacophrenic arteries here are responsible, and the musculophrenic arteries here are responsible for supplying the pericardium itself. And you can see they are branches of the internal thoracic artery, which you did learn, okay? That I will not ask you to know. However, I would like for you to notice, in addition to the vagus coming in here, so you notice the position of the vagus here medially, compared to the position of this nerve, which we call the phrenic nerve. Now, you guys remember the phrenic nerve from our discussion of the cervical plexus. Remember that the phrenic nerve comes from the cervical plexus, specifically C3 to C5. Does everybody remember that? It is the biggest nerve of the cervical plexus. It comes from C3 to C5, and it goes to the diaphragm. In fact, this is its root. You can see the phrenic nerve on either side passes in very close proximity to the heart. What's really interesting about this is that as it passes here on its way to the diaphragm in close proximity to the heart, it actually innervates the pericardium. So it is actually stuck in and attached to the heart itself. And we know that pain from the pericardium, pain from the heart, is actually picked up in this nerve. So if we go back to our original dermatome picture, and we know that the phrenic nerve is coming from C3 to C5, and we know that the dermatomes, this is sensory information that we're experiencing, right? Comes from C3 to C5, then I notice on the anterior view here, C3 here being supraclavicular, C4 being very near, and C5 in the arm. On the posterior aspect, I see C3 up into the occipital region here. And C4 then extending along the upper portion of the spine of the scapula and down the margins of the left arm. These are the locations where people experience pain when they are having a heart attack. This is a phenomenon called referred pain. The phrenic nerve is carrying the pain information from the heart, but your brain is interpreting it as coming from C3, C4, C5 dermatomes, as though I'm having pain in my neck and my arm, but the pain is really coming from my heart. So something that I mentioned to you earlier, and I want you to see it with your own eyes, it is caused by the distribution of sensory fibers into the heart by way of the phrenic nerve. Okay, last thing then, the blood flow to the heart and the heart anatomy. So tomorrow I'm going to give you heart and let you look at these structures. So this is the arterial supply. Okay, let me say this up front. I'm not going to teach you all of the vessels, but I'm going to teach you the ones that will make you competent. If you guys were to go into a heart surgery area at the hospital today, and the heart surgeon asks you what the names of these vessels are that the heart surgeon is dealing with, I want you to be able to say intelligently, these are the ones, y'all. These are the major vessels that the bypass surgeon is going to be dealing with.